Some of the ways that the pandemic had affected people accessing safe spaces for our community. We have one shelter, so just having to kind of adjust the numbers due to physical distancing was really, really challenging. Instead of having the shelter system be more accessible, it actually took that apart. So that started kind of like a trickle effect, I would say, especially when it came to more of like lockdowns and bubbles. And, you're only let out of the house if you're an essential worker. And so like all of these things played a role in some risky things as well. We really noticed large amount of people congregating at specific houses. The benefits of them being together was that people weren't using alone. We were able to, as an outreach worker, I was able to get to a whole group of people rather than, trying to find people individually as they're precariously housed or couch surfing or sleeping outdoors. So, it definitely, there were some benefits to it at the beginning. But really, what ultimately ended up happening is a lot of tenants lost their housing, which didn't just affect the tenant, but it also affected other people that were in their bubble and trying to stay in their group, and were essentially couch surfing at these places, and so we ended up with at one point we had one person that was the tenant and 8 people that were sheltered there safely, and then he was evicted. So that ends up with 9 people that are now, precariously housed and not being able to access the shelter system because, their numbers are also lower on who can stay there. And so, that's like one part of when it comes to, the pandemic and like emergency shelter systems. But then there is also the accessibility of mental health services, addiction services. All of this was accessible online. If you don't have a phone, if you don't have internet, if you don't have a computer, how are you to access these? And I actually, I know people that had been in recovery and due to the pandemic had been disconnected to their support groups, whether it be 12-step and or one-on-one services, and it resulted in a number of people relapsing. This pandemic hasn't been easy for anyone, but we see people that were basically trying to cope the best way that they knew how, and for some that was increasing their substance use. For a lot of people, their drug of choice, the substance that they were used to using, was actually less accessible as well. And so what that looks like is now they're kind of going down a different road to purchase their substance. So yeah, it was just, it halted so many things, and it was obvious for some things, but other things it was just less obvious, I think.